Well, we're going to continue now with an issue that is dear to all of us. And Cindy Padilla said, if you're not thinking about your golden years, you will. And many people are indeed thinking of what will happen, especially with Social Security. And let me tell you that when I'm told that I may not get Social Security or that my son will never get Social Security, I really get upset because this is a contract. This is a contract between the government and all of us. I was willing to give the government to take my money and my employer's money so that when I'm reaching 65, and now I'm hearing that 67, and somebody will say 70 and 77, it doesn't, every time that somebody wants to use some of that money, they want to strengthen it and make it longer until we reach that age. Social Security is very important, and as one of the questions that the congressman received today was precisely why these increases are not happening when, well, the government says that we're not living in inflation, with inflation, but anybody will tell you something different. And so the cost of living adjustments is also something that people talk about, and many people talk about all these issues, and really sometimes we don't know what we're talking about. But our three panelists today will clarify any misconception or any misinformation that we may have. And I'm going to introduce them to you, starting, and I'm going to ask them to come to the panel, to the podium as I introduce them. And I'm going to start with Lisa Pino. She's the Deputy Administrator of the Supplemental Nutrition Assistance Program. Thank you very much, Lisa, for coming with us. And if you can
sit here?
Take your place, yes.
Okay, I'll sit here.
Wherever you like.
Okay.
We're also going to continue with Nancy Altman. She is the co-director of Social Security Works. And same thing, she is here in place of Eric Kingston, the director, the co-director.
Thank you so
much. Thank you so very much, Ms. Altman, for being with us, Nancy. And last but not least, Professor Rene Perez-Rosenbaum, Associate Professor at Michigan State University. Ladies and gentlemen, please help me welcome. Please. As with the previous panel, we're going to be able to ask some of the questions that you may have. And I would like to start by asking Lisa the importance of nutrition programs to Hispanic older adults and how these programs help economic security in the Hispanic community. Tell us about that.
Absolutely. Well, first I just want to say hello, everyone, and thank you so much to the National Hispanic Council on Aging for inviting me here. And I also want to give a very special thanks to Doctora Yanira Cruz. I think you all know this in this room, but you could not have a better advocate speaking on your behalf. She is extremely dedicated and talented. So, buenas tardes. Muchas gracias por tenerme aquí hoy. Mi nombre es Lisa Pino. Trabajo en el Departamento de Agricultura. Es un privilegio estar con todos hoy. The question is talking about how USDA programs, how USDA Food Nutrition Service programs can make a difference in all of your lives and the lives of your respective communities for the aging population. Well, the answer is that our programs can make an incredible difference. Government cannot alone solve the challenge of hunger nor obesity, but we have invested more than $80 billion in programs at USDA, the most ubiquitous of which is the SNAP program. A lo mejor lo conocen como el programa de los alimentos, los cupones, las estampillas, pero ese programa ahora está dando beneficios a más de 46 millones de personas por mes. So the SNAP program, what used to be called the food stamp program, is now providing benefits to more than 46 million people in this country. That's 1 out of every 7 individuals in the country is on the SNAP program. SNAP is only 1 of 15 food and nutrition service programs. And the breadth of our programs is so vast that 1 out of every 4 Americans in the U.S. is receiving help from USDA in some form. It might be SNAP. It might be the WIC program for women, infants, and children, which is critically important for Latinos. More than 42% of our clients in that program are Latinos. It might be the National School Breakfast Program or the National School Lunch Program. It can be the commodity program, which is very popular with the aging population. Or it can be the TFAP program, the Emergency Food Assistance Program, which is the primary vehicle that enables food banks and food pantries all over the U.S. to provide emergency food. So our challenge at USDA and why I'm so excited to be here and very thankful to NHCOA for the invitation is to let all of you know that if you or your loved ones or your communities are facing, as millions of Americans are every day in this tough economic time, are facing challenges with hunger or obesity, because those two trends are deeply intertwined. It seems like a counterintuitive pairing, but they're deeply intertwined. USDA programs can help. And of all of our millions of clients for SNAP, we're only serving 8 million seniors. And even though last year more than 72% of eligible people in the U.S. applied and received support from SNAP, only 34% of eligible seniors are participating in the program, and only 56% of eligible Hispanics are participating in the program. So that means that when you're looking at the aging population for Latinos, they are one of the most vulnerable populations in what we call food insecurity, which is almost synonymous with hunger. And it's really important because we all know that Latinos are suffering higher incidences of diabetes, of hypertension, of cardiac disease, you name it. And sometimes, very often, those chronic diseases are associated with nutrition and diet. So we just want to be able to help everyone who deserves the help. No one in a country as amazing as America should go hungry. No one. That's deplorable. And this administration believes in that very much. And so we want to do whatever we can to get those programs to make a difference for all of you. Thank you very much.
Thank you so much. Ms. Altman, we just had a nice presentation from Congressman Becerra here. From Congressman Becerra a while ago. And he really demonstrated how, in his view, Social Security is sound. And those of us who are expecting to reach the age soon of retirement are wondering, are we going to be able to get all that money that we have been putting in since the first day that we started working? So tell us, is that a fact? Will there be Social Security in 10, 15, 20 years from today?
Absolutely. Let me start again by reiterating what Lisa said in thanks and my praise for Yanira. I'm substituting today for my co-director, Eric Kingston, who wishes he could be here. He had a medical problem. He wants me to be sure to say he is fine, but he just couldn't travel. But I am so glad that Congressman Becerra was here this morning. He is a champion of this program. He is a wonderful member of Congress, someone we work closely with. We are fighting to make sure that Social Security is here. Social Security is extremely affordable. It is important to all Americans, all people in this country. It is particularly important to Hispanics who have the good fortune of living longer than the rest of the population. And unlike, on average, and unlike private accounts or private savings, which you can outlive, you cannot outlive Social Security. It's a guaranteed benefit. If you're fortunate enough to live to 120, you continue to get those benefits. It has become, and it is widely supported by the American people. It is and across the political spectrum, all regions, all age groups. So it's a widely supported program. So the question is, well, what's the problem then? And it's that too many of our leaders, Congressman Becerra is a wonderful exception, too many of our leaders are not representing the will of the people on this. This is a program that can be there. It's very closely monitored. It is actually the most conservatively managed and responsible of all federal programs, and we are fighting to make sure it's there for children, grandchildren, and beyond. It is important to realize that as important as its retirement benefits are, it's really a family protection plan. It provides, it is our nation's largest children's program through its life insurance protection and disability insurance protection. It's our most important disability program. So it helps people throughout the life course. And it is important, though, to make our voices heard, because we are at a particular moment in history where our elected leaders are really undermining confidence. When we can have a Republican nominee for the president call it a Ponzi scheme, which is an illegal, fraudulent activity, is the polar opposite of what Social Security is. It just shows us that there's a lot of misinformation, and we have to make our voices heard. So thank you for having me here.
Many people wonder why they haven't received an increase in their payment on Social Security in the past few years. Would you clarify that for
Absolutely.
us? Why is that?
Absolutely. Before 1972, there were not automatic increases, and then Congress had the wisdom to put in these automatic adjustments, because the concept is that if you want that benefit, if you're going to be receiving it over 10, 20, 30 years, you want it to maintain its purchasing power. You don't want it to erode. So since the early 1970s, every year there has been a cost of living adjustment based on inflation, except the last two. This is really because this was not a decision of Congress or the president. It had to do with the way the inflation is calculated. Now, our coalition has been arguing that that undermeasures inflation, that it really is not an appropriate measure for Social Security, and we've been fighting for a better measure. There should be an increase this year, but still it should be improved so that you don't have those gap years that you've had the last 2 years that were, as I say, it was just a mechanical thing, but it was not corrected. One thing, again, I hate to be the alarmist, but there are those who are arguing for a less generous cost of living adjustment, which we are, again, fighting hard against. But that's the reason there haven't been. There should be one coming up this January, but it won't make up for the loss of the last two.
Well, having said all that, Professor Rosenbaum, what are the strategies, or what is that you're proposing to strengthen Social Security? What can we all do to help for that? That's a very worthy cause. But what can we do as a nation?
Well, one of the things that has been mentioned before, which is part of the strategic plan of this group, is to collaborate. So I applaud Yanira and the association for using that as part of their strategy to collaborate with groups across the country, because collaboration is the key for this, I think. We need to think in terms of recognizing the diversity in our population and the concentration of the fact that there's many people in the western part of the state. But specifically, Latinos tend to have shorter covered earned history. They have lower average monthly earnings and consequently less benefits. So what can we do? Well, we need to cover more Latinos. We need to cover them more effectively. We need to expand coverage by reducing the earnings thresholds required for domestic and other workers to qualify for coverage. We need to improve enforcement of earnings reported in selected industries where unreported is prevalent. We need full access of Social Security regardless of immigration status. 1 in 4 Hispanics that don't qualify because of immigration status. So that's an important issue. In addition to that, many Hispanic seniors care for children, and larger percentages of Hispanic boomers are responsible for caring of relatives. So I think we need to create measures that would provide quarters of income for Social Security credit for those who stay at home to take care of their children and those who take care of their loved ones. We need financial counseling. We need to expand home and community-based term care. We need to update the CPS to reflect elders' true costs. We need to raise the minimum benefit for Social Security. We need to lift the Social Security tax so that we have higher earnings being collected. And we need culturally and linguistically competent outreach and services to help Hispanics, older Americans, just like Janita said.